Well, hello to everybody here. It's Teresa Sanderson. I'm here with you for another episode of Dare to Do Nursing Differently, and I'm very excited to welcome to our show Dr. Alexandria Nyembwe, who is a freelance writer and is going to share with us her story today. Thank you for joining us.
Thank you so much for having me, Teresa. It's a pleasure to be here. I'm really excited.
Oh my gosh, I love it. I'm so glad you're here. And for those of you who don't know Dr. Alexandria yet, here's a little bit of information about her. She is a nurse scientist and a freelance health communications writer. She has a passion for for improving health equity and empowering communities through accessible healthcare information. She has dedicated her career to addressing healthcare disparities, particularly as they relate to heart disease in minority populations. She has a business called Authored by AJP, and she works with healthcare organizations to prepare patient educational materials that take complex medical information and break them down into simple, engaging, understandable content. Welcome again.
Thank you.
Absolutely, absolutely. So, my audience is largely nurses and nurse entrepreneurs, Dr. Alexandria, and most people in my audience are curious about where did you start out in nursing? What's your
Oh,
story? How did you get started and what kind of work did you
woo. So I've been a nurse now since 2017. I am a second career nurse. I took the scenic route.
do?
I have known since I was a kid that I liked medicine and science, but unfortunately, medicine and science didn't always like me. And I say that because I was one of those students that really kind of struggled with the hardcore sciences, the prerequisite courses, right, that we
Yeah.
need to take to get into nursing school. And then you finally pass them, you get into nursing school, and you're like, huh? Like, oh, this was the prerequisites that were necessary. But anyway, I'm a second career nurse. I was a preschool teacher in a past life, and then somewhere down the line, I decided to get my MBA, all of that before finally getting back on that train to do what I always wanted to do and be a nurse. So I've been a nurse now since 2017. Every time I say that, I get a little flustered, like, oh my God, we're coming closer and closer to 10 years. I'm no longer in that baby nurse
Yep.
stage. My background in nursing is in telemetry or cardiovascular nursing. I love all things heart disease and heart health and management of disease and risk factors and things of that nature. I was a nurse, a floor nurse until about 2020 when COVID came.
Okay.
A lot of changes happening in the hospital at the time. And then as with everyone, I'm aging. I'm a millennial, but I have injuries prior to nursing, and COVID was one of those situations where it became a question of, okay, but how long can we do these 12-hour shifts with no breaks?
Yeah.
So I had to pivot, and I ended up pivoting. Fortunately, I was living in Southern California at the time, and California was really proactive about trying to reduce the spread of COVID. So I took on a public health role where
Okay.
I was helping people experiencing homelessness, keeping them off the street, but also keeping them separate so that we reduce the spread of COVID in those particular populations. So I did that
Wow.
for a couple of years, street medicine, clinic work in populations experiencing homelessness, and then I finished my PhD. I did all of that
Oh,
while I was transitioning out of floor nursing and into research
wow.
while getting my PhD. It was an intense time, and then I decided to start a business. So here we are.
I love it. I love it. And I just have to, what you mentioned there about working with the homeless, that just really, I've seen the homeless in Southern California and I know what that looks like.
Yeah.
And it's heartbreaking to see it
Yeah.
all. But at the same time, I had never really truly thought through what would it look like? What would it have looked like for that population in the middle of COVID? And how did you get them some shelter and also keep them distanced? Wow, that was unbelievable experience, I'm sure.
Oh, yes. It was quite the introduction to what public health might look like for different populations, especially
Right.
those, considered socioeconomically disadvantaged. It was an interesting experience, but I learned a lot.
Mhm.
a lot about how to take care of people from different groups moving forward. So very grateful for the experience, and I had some fun, believe it or not.
Well, awesome, awesome. And so it sounds like your journey into entrepreneurship, came after having, worked as a floor nurse, experienced those 12-hour shifts, and then on top of that had some injury or
Yep.
something that you were also managing. And so
Yep.
public health, and then the next step was for you just to hang out your own shingle.
Yep.
Okay,
Yeah.
okay. What drew you to, writing and just getting started? What was the catalyst?
Ooh, that's a hard one for me. So I obtained my MBA before I became a nurse, and I kept saying, I'm gonna use it, I'm gonna use it. Why haven't I started a business? And the fear of it all is what stopped me.
Mhm.
And I remember as I'm going through my PhD studies, and I actually have to back up a little bit because the PhD wasn't the intent initially when I got my nursing degree. I thought I was
Okay.
going to go and be a nurse practitioner. And I put all my eggs in one basket. I applied to one school. They said no. So I said, okay, I'm going to go do research. This is fun too. This was something that I was exposed to in nursing or in
Mhm.
my initial nursing studies. And as I'm going through like that process of starting the PhD, starting my PhD studies, I'm thinking, gosh, Alex, you are really becoming this degree collector. Like it's great that you have all of these degrees, but really truly, what else do you want to do that maybe an employer is not able to provide you? And
Mhm.
sure enough, as I was starting those PhD studies, as I mentioned, I also was transitioning off the floor. And
Wow.
I noticed that one of the things that I really missed, even though I actually didn't realize that I enjoyed it while I was on the floor, was the patient education. The patient
Mhm.
education is always kind of tied or attached to discharge. But I
Yep.
was also educating them at night when I'm giving them their medications. And, they're
Mhm.
asking me, oh, I take that at home? Yes, you do. Let's talk about it. Let's talk about why you're taking this and for how long and if you need to continue to take it and what the condition is for and can this condition be managed without said medication if there's some intervention or some behavioral change that can be made. I had no idea that I really enjoyed that piece of those 12-hour shifts. And so
Mhm.
that's when freelance writing came in. I think I had some other
Wow.
ideas. I said, oh, I'm a cardiovascular nurse. Let me go and do all of these other things. But I was starting my PhD studies. Freelance writing, what really stuck out was that it's something that I can do in my own time. A lot
Mhm.
of the work that goes behind freelance writing is really developing relationships. So I get to pick and choose the companies that I work for, the people that I work for, and I really get to kind of gauge, are you sending a message to the general public about health conditions and truly giving as much of a full picture as possible when it comes to management or treatment or intervention, whatever the case is. And
Mhm.
I just simply couldn't get that with, research, with, being a nurse patient facing all the time. There's just
Right.
something about the patient education. And I finally just said, okay, now, if not now, then like, when are you going to stop letting fear drive you from not starting your own business and just getting your feet wet and learning from the experiences? It's been a ride. But we're making it, right? Isn't that how the
Fantastic. Yeah, I love that. And I love your story of listening to the small little voice inside that was saying, when? When? I'm waiting. When will you
Yeah.
do it? You have this dream, you have this vision. And so for anybody in the audience who's listening right now, I just want to encourage you, take the leap. You know, the things that we regret in life are the risks we didn't take, the things that we wish we'd done, and that's just, I just love that you took the leap. And as you said, now we're making it.
Yeah.
For me, as an entrepreneur, I really believe it comes down to just making a decision.
Yeah.
I decided, I stepped into it. It's, you know, just like if I decide to take a job, I'm going to show up every day. So I
Yeah.
decide every day I'm going to be an entrepreneur. I go to my office, I do the things, the necessary things, and we just keep going, right?
Yeah, and even that last part about making that daily choice, I know for a fact, even now I'm 3 years into my business. These last couple of weeks, last month, like personal life has just been lifing. And I realized as I was talking to my dad yesterday, I said, oh my God, I haven't been making the choice to show up for myself in this business. I have to get back together with myself. And it's true, like, but that's all part of this process. You know, we think that Amazon was built overnight. It wasn't. We think that
Right.
Starbucks was built overnight. It wasn't. These companies have been around for decades, and they're
Mhm.
just now starting to be those conglomerates that we know them to be today. But someone,
Mhm.
it literally started with one or two people, every single
Yeah.
one. So
Oh, I love that. And that's what, I think people would say, oh my gosh, they're just an overnight success. This person just showed up. Well, you didn't see all the paddling underwater that that was
yeah.
going on for who knows how long, right?
Yeah.
Yeah, I love that. Well, great story. So tell me, um, how do you serve your clients today? You talked about, the health writing that you do. Tell us a little bit about how you serve your clients.
So, I mean, that's really a twofold question. So, really, my client, as far as I'm concerned, is whoever's reading my articles. So, I'm very mindful about where I'm publishing, who I'm working with. Now, of course, I can't reach, directly the people who are reading my
Sure.
articles. I have an idea of who's reading. So I definitely pay attention when clients come to me. I pay attention to who they feel as though they're serving and
Mhm.
what the overall goal is for them. So with those writing clients, I'm working with them on an as needed basis. So the workload absolutely changes from week to week. Sometimes there's these heavy loads of projects all at once. And then even now, like now that the new year has started, actually things have been quiet for me, which is not a bad thing because it allows me to kind of have some space to deal with personal, but also
Sure.
a space to kind of regenerate. So on one side, I'm focusing on those people who are actively Googling, heart failure and how to
Mhm.
manage it and working with clients who truly want to provide a well-rounded picture of what that looks like, resources that might be available to them, even if it's not at the local level. And then on
Mhm.
the flip side of that, I'm also, in my own ways, I've been helping other nurses who have been reaching out and are really interested in starting their own freelance writing business. And I'm
Mhm.
just doing my best to provide answers, resources, and make myself available for people who are interested because, I mean, we are entering a time right now where healthcare looks different.
It does.
And and management of time looks different and people are starting to become curious about what else they can do beyond working at the bedside, beyond
Mhm.
working in administration, nursing education, beyond any clock in, clock out salary position. And I'm doing my best to just make sure that I'm present and allowing people a space, or at least trying to be a part of their community and maybe even creating my own where people who are interested in freelance writing can have some support. I know I will say I could have done a better job myself of developing my own community of people as I got my business started. And now that I'm finally getting my feet kind of firmly planted in this arena, I'm trying to pay that forward so that the next nurse who comes in doesn't feel like, oh my God, where do I start?
Yes. Oh my goodness. I love that. I love all of that. And so much of what you're sharing leads right into, the Nurses Feed Their Young movement that you and I have connected upon
Yeah.
or within and also the Thriving Nurse Network. And so I want to share with our community now and our viewers and listeners that, Dr. Alexandria Nyembwe is serving as one of our nifty experts within the Thriving Nurse Network community. And we're just so excited to have you representing nurses in freelance writing. And so
Thank you.
just what a great asset. And so as you talk about, sharing resources and being available, the Thriving Nurse Network is going to be where another great space where people can connect with you
Yeah.
and learn from you and, ask questions about what
Yeah.
it is that you do. So I love that you're there with us. Thank you for making the leap and joining us.
Thank you for providing the opportunity. I mean, I'm finding that there are more and more nurse communities out there, but it's hard to find sometimes. And there are so many platforms, so many social media outlets, conferences, and simply just word of mouth. It's hard to keep up sometimes, but there are a lot of people out there who really do want to promote community. And I know that you're one of those people. So thank you for providing the space for us to do that and have that space to feel safe and welcome and heard and afraid, but
Yeah.
still going through the trenches with someone rather than alone.
Oh, I just love that. Yes. And I hear so much about, from nurses who want to start a business and they don't know how.
Hmm.
We hear from frontline nurses who are, struggling, and a common theme that I hear from nurses is, Teresa, I would love to start a business. I don't know how. What else can I do? As you and I discussed earlier, what else can I do with my nursing degree? I have no idea. This is
Hmm.
all I've ever done. And I
Yeah.
want something more in my life. I'd love to have more balance, more time with my family, but I don't know where to begin. What is the one piece of advice that you would share with a nurse in that position?
Oh, it sounds so cliche, but it's true when I say now is the time to start your business. Figure out what the business idea is, start drafting a business plan, and then figure out what your resources are that you need or that you have already, and figure out how to use them to get the business started. I mean, the world is changing and we are slowly, if we haven't already, we are or have shifted away from the ability for a single paycheck to take care of a household or even one individual to have a check that allows them to retire or plan for retirement and travel and have kids and God forbid have some type of disability or health condition that they need to take care of. And I'm not sure. I'm a little bit nervous to see how things are going to continue to shift as we just continue to age and we continue to see shifts in administrations, but also chronic conditions. Those are also not going away and are not necessarily directly affected by any type of policy or law. And it becomes really important that you start thinking about your future sooner rather than later. So if you are ready to start a business, now is the time. Find something to get started in, and even just starting with one item a day to get yourself moving, do it.
Oh, I just love that. I love that. And that's an interesting thing about business. I love the advice. Now is the time. Nurse innovators are making big changes in what's going on in healthcare right now. And we all know as nurses that we are driven to provide excellence in patient care. We really want optimal patient outcomes. So
Yeah.
nurses who are stepping up and doing concierge nursing,
Mm.
lots of different types of nursing using your degree, but in a different way, are making a big, big difference in the lives of patients and families. So I agree. Now is the time before you sign up for another PRN shift.
Yeah.
Make a decision to do something you'll be so grateful for in your future. Oh, I love that. Good stuff, girl. All
Thank
right.
you.
So one last thing before we finish up today, Dr. Alexandria. I would love for you to be able to share with our viewers how can they connect with you outside of this interview? How can they find you on social media and that kind of thing? So the floor is yours.
Yeah, so LinkedIn is probably the easiest place to find me at this point, and I'm happy to send you, Teresa, my email, and people can reach out to me there. I'm
Okay.
always on my emails, and if I'm not on my emails, then I'm scoping through LinkedIn, even sometimes if I'm just not posting. So people can definitely find me there. And they can also check out my website if they're interested in knowing more about me and the work that I'm doing. If they do decide to scour that website, you'll find some of my published work. You'll find out some more information about why I started that website or why I started the business. I do have a couple of freebies on there. I know I have an ebook on Beyond the Bedside and just kind of
Oh,
talking through what that feeling might be like of, oh my God, I think I'm ready to leave the bedside. So I have an ebook there. I also have a book for people who are interested in becoming a freelance writer called The Right Remedy. And it just gives you some pretty quick tips and tricks on things that I went through my first year as a freelance writer, from getting started to landing that first client to getting that first paycheck. So for anybody who's interested, you can check that out. And then also on my website, I do have a link to a course. I started a course on freelance writing and how to get started, uh, full of information in there, things from letters of introduction to pitching to lead lists and keeping track of people that you've reached out to. You'll also get a one-on-one session with me. And for those who join this platform or listen to this podcast, I do have a special link for a discounted rate for that course that I will be sharing with you, Teresa. So thank you.
Oh,
Thank you
love
for
that.
listening to me for all of this time.
No, I love that. I love that. I think that's wonderful. And who better to learn from than somebody who has started, a successful business in that space. So thank you for sharing all of that.
Yeah.
And for those of you who are nurses and who are thinking of, starting a business in freelance writing, I believe that's one of the things that's trending right now for
Yeah.
nursing is writing health related content. So I encourage you to connect on LinkedIn or on the website to Dr. Alexandria Nyembwe. And this concludes this episode of the Nurse Entrepreneur Spotlight. I want to thank you again for joining me today, Dr. Alexandria. Thank you for being here and sharing time.
Thank you so much for having me. It was a pleasure.
Same, same. All right. And thank you, everybody, for viewing and listening today. We'll see you next time on Dare to Do Nursing Differently. Bye for now.